Hi, this is Dr. Mercola helping you take control of your health. And of course, we are all consumed with the COVID-19 pandemic from a large variety of reasons, primarily because most of us are confined to our homes and the social distancing. And, and more importantly, especially as time progresses, is the consequences of the worldwide and economic collapse that's going to cause so many people to have financial complications. So what we see in China, it's really interesting that 80% of the people who died were over 60. And in Italy, 80% of the people who died were over 70. So it leaves about 10 to 15% of the others under 50. And what was the common denominator in those who passed away that were under 50? Well, primarily they had three things going on. They were overweight or obese, they had high blood pressure, and had diabetes, or a combination of those. So what is the common denominator between all of those clinical conditions? Insulin resistance. And I think this is why it's going to be really important to understand addressing the foundational causes of insulin resistance will not only radically decrease your risk from dying from this infection and pretty much all other diseases, but it will radically improve your health overall. And these are things I've been speaking about for a long time. So what are those? I just want to focus on these basics. And after we have these basics, I'm going to provide you with a powerful intervention that and the details on how to apply that. So what are those strategies? One is time restricted eating. That is compressing the number of hours that you're eating within 6 to 8 hours, and maybe even down to 4 hours or so. What will this do? This will radically decrease insulin resistance and improve your metabolic health, improve your body's ability to create an important biological molecule, NAD, and its cousin NADPH, which are really incredibly useful for reducing oxidative stress in the body. Then, of course, you're going to want to exercise. And exercise does two important components, especially in regards to this infection. One is that it also increases NAD, but it will increase nitric oxide if you're doing the right types of exercises. And nitric oxide has been shown in previous coronavirus infections and SARS infections to be incredibly useful at controlling viral replication. So my favorite exercise, of course, is blood flow restriction therapy or blood flow restriction training, BFR. And you can look on my site, and I have manuals and free PDFs and videos and great details on how to do this. Then, of course, you're going to want to optimize your vitamin D levels. And the only way you can know that you're doing this is to measure your blood. So get your blood level tested. Make sure it's at least 60 nanograms per milliliter. And you'd have to multiply that number by 2.5 to get the nanomoles per liter if you're in a European or Canadian blood test. So the best way to get that, of course, is exposing large amounts of your skin to the sun. Just that is the absolute best way. And if you're not doing that, then you're going to want to probably take anywhere from 2 to 10,000 units a day to optimize. But again, you need to measure your blood levels. And of course, you want to sleep, because if you have issues with your sleep, you're not getting enough high quality sleep, that's clearly going to have a radical decrease in the function of your immune system. Ones that I'm going to be sharing with real soon is molecular hydrogen. Tyler LeBaron has just done an incredible video that talks about the mechanisms and how this can be such a useful strategy for not improving your general health, because it's a selective antioxidant, but also radically decreasing cytokine storms that we see in the COVID-19 infection. Zinc is a useful supplement, and by itself it's not too useful, but you need to make sure you have enough zinc on board. And we are even seeing this with some of the traditional medications now that are being recommended, primarily the Plaquenil or hydroxychloroquine. And we believe that the reason why that specific drug works is because it's a zinc ionophore. In other words, it takes the zinc in your blood and actually gets it into the cells. And then some other key things is you do not want to suppress your fever. If you have a fever, that is the reason one of the strategies your body uses to fight the infection. The high temperatures will help you resolve it. So when you suppress the fever with with antipyretics like acetaminophen, Tylenol, aspirin, ibuprofen, these are going to have negative adverse consequences and will radically increase your risk of side effects and potentially your risk for dying from this disease. So the converse of this, and I'm doing an extensive video on this to document, and we've done articles on the benefits of sauna, but I'm going to go dive deep into the immune system benefits and why you need to seriously consider using the sauna, but that's going to be for a future video. So let's get down to this one and the specific intervention you can use to help you fight any viral infection. And you may remember, if you've been on my site for a while, a video I did in 2006, yes, 14 years ago, and it's quite entertaining to look at it. We're going to put a link not only on our site where this document appears, but hopefully in the description on the YouTube video. So you can click to that and you can see what I was recommending for hydrogen peroxide 14 years ago. And back then essentially was taking simple peroxide, tilting your head to the side, and pouring a cap full of the peroxide into your ear and holding it there for a few minutes. And that seemed to work. It worked better at the closer to the time that you developed the onset of the symptoms using it, but it was cumbersome and it wasn't 100%. Very few things in life or medicine or health, certainly 100%. And this clearly was one of those. So, but it was useful. But now there's clearly a better and more effective way to apply the hydrogen peroxide. But before I get into that specific way, I want to review the history of hydrogen peroxide. Okay, so if hydrogen peroxide is so effective, what does it work for? Because it doesn't work for all organisms. It clearly doesn't. And this figure that is in the book or the chapter really gives us a very good illustration of what it's effective for. And you can see as we go down, the infections that's most sensitive for are at the bottom, and then the ones that are least sensitive for are at the top. So that would be prions or prions. It doesn't work at all for that, or even bacterial spores like bacillus, protozoas or helminth eggs, or even mycobacterium like Mycobacterium tuberculosis. So this is not, these infections you would not want to use peroxide for. But look at the bottom. What is it most effective for? Enveloped viruses like HIV, hepatitis B, influenza, and of course this article was written 6 years ago, so we did have SARS virus. We certainly didn't have SARS-CoV-2, but it would be highly effective for envelope viruses, of which coronavirus is an example of. And then you can go up and you can see it works for even bacteria too. But it works particularly well for viruses. So this gives us great hope that this simple, safe, and effective therapy can have some use in the seasonal upper respiratory infections that we acquire. So they didn't specifically mention coronavirus or SARS, but there are other studies that do. And we see that a study published just last month in the Journal of Hospital Infection, 2020 in March, the persistence of coronaviruses on inanimate surfaces and their inactivation with biocidal agents. Now, this study reviewed 22 other studies, and they point out that the SARS and MERS virus and human coronavirus can persist on inanimate surfaces like metal, glass, or plastic for up to 9 days. But, and here is the key, it can be efficiently inactivated by surface disinfection procedures with either 60 to 70% alcohol or 0.5% peroxide or 0.1% bleach within 1 minute. That is incredible. So here we have a recent study showing that a relatively low dose of hydrogen peroxide, 0.5%, can inactivate human coronavirus. Here we have an article on how we can use hydrogen peroxide for disinfection and actually sterilization, but we're going to focus on the disinfection side. So as you can see, as we start to go into the introduction of this article, that, and this might be surprising to many, that we've actually been using hydrogen peroxide for medical purposes for over 2 centuries. As we get into the article, we find that because hydrogen peroxide was used at such a long time ago, its primary competition at the time was mercury. So clearly it was superior. And in fact, it showed that it could have dramatic effects on decreasing these infections and without having any long-term toxicity. And I think that is the key here, folks. It is really safe. If it's used appropriately, there essentially are no side effects. So, and this was primarily being demonstrated in the use of wound infections. So, if hydrogen peroxide was so effective and so safe, why did they stop using it? Well, if we look into this first article that I showed you, we find out that the obvious is that in the 1940s, we developed penicillin and then subsequently more powerful and effective antibiotics, and hydrogen peroxide fell out of use. So even though peroxide was essentially abandoned about 80 years ago as a systemic approach, when antibiotics were first introduced, it was picked up again about 30 years ago by Dr. Charles Farr, and he used it as an intravenous therapy. And soon after that, Dr. Frank Shallenberger, alternative medicine physician, recognized that nebulizing it, which we're going to talk about in a moment, was equally as effective. And when I was interviewing Drs. Tom Levy and Robert Rowan, who I've had on my site within the last week or so, I learned that they were both using this amazing revision that involves nebulizing hydrogen peroxide. So they catalyzed my interest in doing this video and offering it to you as an effective, simple solution. So we know it works very well for viruses. And in table 1, we see that the descriptions of an ideal biocide or solution or intervention that would be useful for treating infectious agents. And then we list hydrogen peroxide on the right side, and you can see that it's active against a specific target. And we just showed in the previous figure that it was really useful for viruses, rapidly active, and that certainly peroxide qualifies, low or no toxicity, which is key. Again, the concentration is going to be important because if you have too high concentration, it could be lethal, but in the right doses, and it's easy to use, there's essentially no toxicity. And it's safe, and it's easy, and it's inexpensive, and it's stable and environmentally friendly. So it hits all the marks on an ideal antiviral intervention. There's no way to know for sure precisely what the mechanism of action is for hydrogen peroxide, since no one studied this specifically. But we believe it acts superficially on the epithelium of where the nebulized peroxide is landing. However, there could be another mechanism, and one that I want to share with you is from my favorite medical, or actually science journal, which is Nature Reviews and Molecular Biology. And this is one from just last week. It's called Reactive Oxygen Species as a Pleiotropic Physiological Signaling Agent. And you may not be familiar with the concept of antagonistic pleiotropy, but it essentially refers to the scenario where there are conditions that biological molecules are actually useful and beneficial in one circumstance, and in another, they can be highly counterproductive. So, and this actually happens to apply to hydrogen peroxide. So I like this Nature Reviews Molecular Cell Biology so much because they typically have some of the best. It's just a review, and they are typically invited. They only publish maybe 1 or 2 articles a month, so it's not that many, and they're really probably the best in the entire field once they get published. So this review gives us a suggestion that the peroxide may not only be working superficially, but may actually have a mechanism of action related to its biological signaling mechanism. So one of the ways that the peroxide may work as a signaling molecule is that it is used by myeloperoxidase, which is a very powerful enzyme that generates a profoundly important oxidant called hypochlorous acid, which is actually used by neutrophils when they're seeking to destroy pathogens and like viruses and bacteria. So it basically signals the body to make this, because peroxide by itself is a relatively, at least in biological concentrations, it's relatively weak with respect to its ability to destroy pathogens. Now, the concentrations that's being used when it's used in a nebulized form is a lot higher concentrations. That's probably why it works topically. But in the normal levels that we see in the cell, which we can augment more than likely, and the thought here is that because it seems to be freely permeable to the cells and cell membranes, that we are likely increasing intracellular hydrogen peroxide concentrations, and in that way it may function as a biological signaling molecule. Okay, and now we can go to figure 3, which seems to be an overwhelmingly complex pathways of biology, but I think it does a brilliant job of illustrating the many profound ways that hydrogen peroxide is integrated into your biology, and not just acting as a topical disinfectant. So there's a lot to digest here, and I can actually move down further so you can see what the description of this figure is, and helps explain. So if you're interested in the details, you can just pause the video on hold and then look at some of these pathways to see the incredible ways that peroxide is acting as this biological signaling molecule in your body. So it appears that nebulized peroxide could act as a topical disinfectant or as a biological signaling molecule, but we don't know. The studies haven't been done. And the studies certainly haven't been done, the randomized placebo-controlled double-blind trials, to see if this works in coronavirus infections. So, but you know what? There are no double-blind placebo-controlled randomized trials that are published yet for any intervention in SARS-CoV-2 for COVID-19. So considering that nebulized peroxide is A, inexpensive, B, incredibly safe if used at the right concentration, especially if you're using food-grade peroxide, essentially has no toxicity, and it would seem that it would be beyond reasonable to try this as a simple strategy to not only treat but prevent any viral infections like SARS-CoV-2. Now we're going to talk about nebulization therapy. What is it? Well, it's a process where you take a liquid or a medication and you put it into a device that essentially aerosolizes it so that you can easily inhale it. So this allows direct contact of whatever you're nebulizing to hit the surfaces that you're trying to treat. In this case, it would be the mucosal linings of our sinuses, our nasal and oral cavity, our throat, and of course our respiratory tract. So one of the reasons why nebulization therapy appears to be so effective is because you're putting the peroxide exactly where it needs to be. In this case, where they land. And some people believe that the infection starts because the virus lands in your nose, and your nose tends to be a cooler place, and that's where they tend to replicate and multiply. So if you can get the peroxide up there, it will act as a topical local disinfectant where the virus is residing. So, and that's probably one of the reasons why sauna therapy works so effectively. As I said, I'm going to do another video on that and I'll launch that really soon. So now we come to the tricky part of the process where we make up the peroxide that we're going to nebulize into our lungs and sinuses. So how do you do that? Well, first of all, you have to get the food grade peroxide, and that typically comes in a variety of different concentrations. The normal concentration is 35%. Many distributors cut that down to 12%, and some even to 3%. So depending on what you're going to start with, it determines how much you're going to add. Now, what is the final dose you want to reach? Well, Dr. Charles Farr is the person who first started using this peroxide for infectious problems last century, and he did it by adding 5 mLs or 5 cc's of food grade peroxide into 100 mLs of normal saline, which is essentially results in a 0.015% concentration of peroxide. And then Dr. Frank Shallenberger picked that up and realized that it probably would work nebulized, and use the same concentration, 5 mLs of 3% into 100 mLs of normal saline. and he started getting good results. He's been using this for 10, 20 years now, and most of his patients, he tells me, just don't come down with the flu if they're using this protocol. However, he's increased the concentration a little bit down, instead of 0.015%, probably at 0.02%, 0.03%, maybe in some cases 0.05%, but still significantly less than the 3%, which is what Tom was using when he discussed this protocol with me. But I think his concentration is too high. There may be some problems with that. So I think to be on the safe side, you need to be below 1%, and maybe even as low as 0.015%, 0.02%, 0.03%, somewhere in that range. So the key is, once you have your concentrate, you're going to dilute it. Don't just dilute it with tap water. It would be a mistake. Do it with clean, purified, either distilled, reverse osmosis water, so there's no contaminants in there. Just like you don't want the stabilizers in regular peroxide, you don't want contaminated in the tap water. But using distilled water is not the best process if you're going to be nebulizing it. So you want to use the normal saline. And the way you create normal saline is to take that clean water and put half of a teaspoon into a cup of water and mix it really well, and that will essentially turn it into physiological normal saline. And the reason you want to do that is the concentration of the salt will not in the saline that you create will not damage the cells that you're spraying the peroxide on, because if it's just distilled water, it can create an osmotic differential, which can damage cell membranes. So do that carefully and use the right concentration. And I believe we have a table located lower in this article to help you figure out what the concentration should be. But essentially, if you're at too high a concentration, you're going to notice some burning. And if you notice the burning, it probably is too high, so you want to cut it back. If you're at a really low concentration, like 0.015%, and you've tried it and it's not getting better, then you may want to consider increasing it, maybe doubling, tripling it, but still keeping it below 1%. So you've got your peroxide, you've got the right concentration. Then, of course, you're going to need a nebulizer. A nebulizer is a device that will convert that liquid to a mist. There are basically two different types of nebulizers that you can get. They're both available on Amazon, or probably other stores too, but that's going to be the easiest, especially when you're in social and confined to your home. But this is one that typically sells for about $30, $40 on Amazon. There's a wide variety of different types. Essentially, they come with a cap that you open up at the top, and then you would open it, and then you would put in the peroxide there. Then you put the mask on, and there is this specific one has a battery inside, or you can hook it up to a USB cord, which is a lot easier. This way you don't waste batteries, and it's just, it's kind of, sometimes if the batteries aren't strong enough, it won't work, and then you just have an on-off button, and it will nebulize the peroxide, and you would just breathe it in and out. That's one way, and it's about $30. I like a little more powerful nebulizer. I don't know the name of it, but it says Trek S on it, I guess. Trek S. This is the motor that actually has a compressor that actually comes out and causes an airstream to go through this tube. And it actually can be hooked up to a lithium-ion battery. This is it's under $100, typically about $70 or so. And you can plug it into a power outlet here with a power adapter. Just use it with the power supply that comes with it. If you want it to be more portable, you can buy for another $75 or so, a lithium-ion battery that goes with this. It's not necessary, though, and the number of times that you're going to be using it, it's probably just easiest to simply use the power supply that comes with it. So you're going to, now if you have your large bottle of peroxide, and you're going to put it into, this is the nebulizer that comes with this device, and you're going to open up the top, and this is the well where you would insert the peroxide. Now, you're going to want to be somewhat precise with your peroxide, so you could pour it in here, but that would not be very precise. So with it, or use a teaspoon. But I would just get an empty bottle that you have laying around, a dropper bottle, and then put the peroxide in there, the final concentration, ideally the food grade, and then you'll just take a dropper full, and typically take about 3 dropperfuls, and you would put it into this into the device, nebulizer, or the container, I guess, and then close it. You put the mask on. Now, it also comes with a mouthpiece that you can breathe it in. I think it's going to be better to use the mask because the mask will get in your sinuses too. You can breathe a little bit into your mouth when you're putting it on. So you put the mask on. You would put one side of the tubing on the output well for the compressor, and you put the other on the bottom of the nebulizer. And then put the mask on, and you're ready to run to the races. You put it over your mouth, and you turn on the compressor. Then you just put it on start, and you'll see the mist coming straight out. And you just do this for like 10 or 15 minutes or so. So that brings up the next question is how frequently do you do this? If you're sick, I would do it like 4 times a day, maybe even more, but that's about all that you need. And if you're doing it as a prevention, maybe just once a day or so. If you're exposed to someone in your family, you've just traveled, and you're concerned that you had an exposure. Well, if you've got some of the coronavirus that's landed in your nasal mucosa or your respiratory tract, the peroxide, as we've seen, is a powerful way to inactivate the virus safely and inexpensively. Now, actually, there's one other form of administration that I neglected to mention, that if you, for whatever reason, you're unable to get access to a nebulizer or of either type, you can take a simple spray bottle that you might have laying around the house, like just a 2-ounce spray bottle. You can do 4 ounce, and you can put the peroxide in here and just spray it up into your nasal cavities, and then put it in your mouth and breathe it in that way. Now, this is not going to be as effective, but it's essentially going to be almost free because you probably have a spray bottle at home and can do it. I wouldn't recommend that, but if that's all you have or that's all you can afford, then you can try that. Some people may not be able to tolerate that. They may become uncomfortable, might be a little burning or something. And then you can, if that's the case, then just simply dilute it. And if it's still too strong, you can dilute it again to 0.75%. And as you saw in the earlier article I showed you, it seems to be effective as a disinfectant at 0.5%. So it'll still work. I'm really excited to share this powerful information with you because it's such a powerful, simple, practical, safe, and effective and inexpensive solution and strategy. But what do you do if someone is really sick? If you're one of those people or have a relative or a friend or a neighbor who is actually has the infection, is in the hospital, is on a respirator, or getting to that point, he's one of the 20% who seem to become infected and send to deteriorate, or crash, and require hospitalization. So ideally, if you're in that scenario prior to the respirator, there are some interventions that can be very, very useful. We've discussed some of them on the website, so let me just review them. That would be intravenous vitamin C. Before you go to the intravenous, though, probably liposomal vitamin C, high doses, 5, 6 every hour or so would probably be a good strategy if you're treating the infection actively. Next level up would be the intravenous vitamin C, and we've just done many articles on that. But what seems to be even better than intravenous vitamin C is the ozone. And I did an interview with Dr. Robert Rowan that discusses this. It's a far more potent and effective oxidizing agent. And I'm really confident that if this was widely used, the number of deaths from COVID-19 would probably be reduced well over 90%. I mean, it's just crazy that it's not being used. It's simple, safe, and effective. Dr. Rowan actually went to Sierra Leone to treat the Ebola infection, and did it for the only cost was the cost of a disposable capillary needle, because you could do direct intravenous ozone application, and it's pretty incredible. So, but another therapy that's not being utilized is hyperbaric oxygen chambers. And this would be the hospital grade, the ones that are in a hard shell chamber that uses full liquid oxygen, because there's some concern that using a respirator for those who have COVID-19 may be highly counterproductive. And this is a result of the complications that result from the SARS coronavirus infections within the lungs, which causes this massive oxidative stress, collapse of the alveoli, inability to have this exchange of gases with carbon dioxide and oxygen within the lung itself because of this collapse and disruption of the surfactant and and essentially lung physiology is highly disrupted. So when you have hyperbaric oxygen, you actually force the oxygen into the entire tissues, and you're not relying on hemoglobin to transfer the oxygen in and out through the lungs. It actually goes into all the tissues of your body, especially when you're using full 100% liquid oxygen, and you're getting it under pressure, typically 1, 2, 2.5, even 3 atmospheres of pressure. So, and the beautiful thing about it, with you think, well, how are you going to treat these patients in the ICU? They're infected, they're going to contaminate everything. Well, when you go into the chamber, oxygen under high atmospheric pressure will absolutely inactivate the viruses. So you don't even have to worry about decontamination processes, because you can't, the virus cannot survive in a hyperbaric oxygen environment, just won't. So these are strategies that are sadly and unfortunately being ignored by the medical community at the expense of many thousands of people passing prematurely and unnecessarily. So hopefully you'll share this video with and the useful information with those of your friends and those that you love, because it's not going to be shared on Google. I can assure you, we've been kicked out of Google since last June, and you will not find this information there. So you're going to have to rely on you sending it out to the people you know and love and care for. So hopefully it's helpful. And if you have any questions or comments, just write them in the article, and we'll seek to address those.